This is a UNEP program that in every district the program runs, and all these vaccines, their processes of how they come to our country, their processes on how they are delivered to our facilities and to the districts and facilities, their processes on how these vaccines also are disseminated to the lower facilities, and not only in all our lower facilities that are vaccinating, and it goes as far as in outreach mode where these vaccines are taken right to the community in outreach mode. So therefore, it's a big program that we see over time that it has a key importance to the nation, that we shall come to that part in another session where we shall really appreciate what this program of immunization has helped the country in.
Okay, yeah, thank you so much, Sister, for helping us with the background of immunization, and she really went into the details. But I want to invite Dr. Gift to give us the general services, immunization services that is running on right now. What are the services that we have?
Thank you very much, moderator, and dear viewers. In Uganda, we basically implemented two immunization service packages. Either we are doing routine immunization services or we are doing supplementary immunization services. The routine immunization services is usually the one whereby once the baby is born, the baby is supposed to enter into an immunization schedule, and it receives antigens one at a time until the time when we will say that the baby has completed the provided for immunization schedule. The supplementary immunization usually comes in where there is a problem, where there is an outbreak. You need to protect the rest of the children in the target group from getting infected with the vaccine preventable disease that has broken out in the community. So that usually comes in form of campaigns where the ministry usually says we need to vaccinate every child in this category of age against a specific disease that has been discovered to be an outbreak in the community. So those are the two modes of immunization activities usually NEP implements. The diseases like Sister Sally has just said have now shot up to 14. The newborn in the house is now the malaria vaccine that we have introduced. Usually the routine schedule provides for immunization services at the health facility, which is known as the static immunization. Then it also gives an opportunity to the health workers to be able to go into the communities and offer these services as outreach immunization services. However, UNEP usually has a program that every April and every October of the year, UNEP supports the districts to intensify the routine immunization activities, whereby health workers are facilitated to move into the communities, mobilize, and discover as much as possible children who have not been reached with immunization services, which we call the zero dose. Those are children who have never received any dose of the vaccines. Then they also go ahead and discover children who are under-immunized. Under-immunized in the sense that they started the immunization schedule or the immunization services, but they have not been able to complete in time because for one reason or another, they were unable to be brought to receive the vaccines in time. So the districts usually move out to look for those kind of children so that they are brought to the immunization point and vaccinated so that we reduce the risk of outbreaks as much as possible.
Okay, yeah, thank you so much for really giving us that immunization. And you talked so much about the routine immunization and also supplemented immunizations right there. But I'm interested in the routine immunization because many children, like you said, some of the children, they have 0 dose, meaning that they have not taken any immunization. I wanted to know whether it is really possible that in the Uganda of today that there is a child that has not been immunized or never been immunized since they are born. I don't know whether we have that data, but if it is there or if it happens, maybe it will be good to clear the air.
Yeah, thank you so much. The fact is that we have children who have never tested these vaccines. Data has shown us that, have not come with the exact figure, but that affects our region so much, especially the Western region, that we are having children that have never got any dose of vaccine.
So what could be the reason as to why a child that is born is not being immunized? What could be the possible cause? Because these campaigns have been all over, and in hospitals, I know they cannot allow a child to just be born and without giving them any immunization afterwards. So I don't know what could be the reason as to why there is still 0 dose of immunization.
Yeah, thank you so much. The reasons can be various. One, attitude of the community. Find the parents, there are parents who really do not have that I don't care attitude, that they do not mind and they do not really feel the importance of this vaccination. Two, some reasons can be due to lack of awareness. And it's true, some parents, they fail to get these messages. Much as we are here in TV, there are those who are not able to watch what we are speaking. Even there are those who are unable to come to the nearest health facility to get this health information. And much as the health workers reach the communities, they also fail even to come to the community services to listen to those and get informed about what is happening. And of course, some of the cases can be as a result of the border influence. So some of these parents, especially districts that are along the borderline, so parents, there's that movement between borders. So some parents deliver across the border and they do not mind bringing this child for immunization. We also have farming communities along, especially our region. Then some of these mothers tend to move to farming places in a distance, and they probably forget really to take their children for services. Much as these health facilities may be where the farming will be, but some of these farm areas are very far and away from where these parents reside. And then, of course, it calls for both parties, both the community, other stakeholders, plus the health workers to increase on the awareness and also to use all strategies to bring out these 0 dose children so that the community is protected.
Okay. That is it. There is still a child there who has never received any vaccine, and this is not good news for us. And we should make sure that every child that is born should get the vaccine. So talking about under-immunization, sometimes I think parents think that, okay, maybe they have got the early dose of the immunization and nothing can happen to this child. So what are the effects, or is there any effect at all if maybe the child has received the initial immunization and now there are some doses they have missed? Can it affect the growth of the child, or can it do any harm to the child or anything?
Yeah, thank you. A child who has never completed this vaccination, it has a risk because this child is not fully protected, and these are children who can easily fall sick because their body immunity has not been boosted very well with the vaccines. And secondly, these children, their growth is affected because the child who always falls sick every time, the growth will be affected. And thirdly, these children who are partially immunized, they stand in risk of getting these outbreaks. We commonly hear these outbreaks of measles, various diseases, immunizable diseases, and those cases, because if there are many who have not been able to complete their vaccination, then that puts the community in a very tricky position that outbreak can easily occur in this kind of country.
Okay, yeah, so if your child has not fully been vaccinated, just know that your child is also at risk of getting infected by other diseases, as Sister Sally has been telling us. Let me get to Dr. Gift. What is the status of West Nile General when it comes to the routine vaccination? How is West Nile doing? Are we on 100, or what is the status? How are we performing?
Thank you very much, moderator. The performance of the district is usually assessed in terms of the access to the immunization services and also the utilization of the immunization services. So the child, once he or she has been born, is supposed to enter into the routine immunization schedule. There are vaccines that the child receives first. Those are the vaccines that enter the child into the schedule. They actually indicate an access. But how the child is going to utilize the services, whether the child utilizes them partially or utilizes them fully, will depend on whether this child is going to complete all the vaccines on the schedule in time or not. So the two things are used to categorize the districts into about 4 categories. So if you look at the picture in Western Nile, we still have a good number of our districts that are not doing well. They are either in category 3 or they are in category 4. The district in category 3 means that the district is having good access and poor utilization of the immunization services. That means many children enter into the circle, but they don't finish. Districts that in category 4 are the ones that have poor access and poor utilization. That means not all the children that are eligible in the district are able to start the routine immunization services. And yet, we see few of them even finishing the routine immunization service. So that means we have a problem. And the risk this brings in is the issue of the outbreaks. There's something that is known as herd immunity. Herd immunity is derived from vaccinating majority of the children in the community. If you have a community where most of the children have been vaccinated fully against the vaccine-preventable diseases, such a community is going to have a high level of herd immunity in the sense that if the disease enters from outside into such a community, it will find that most of the children are vaccinated. Therefore, it will have minimal interaction with the children who were actually not vaccinated within the community. So, if you have districts that are in category 3 and category 4 that have issues to do with the access and utilization of immunization services, when a disease enters in, for instance, if there's an unvaccinated child who has come with the measles from, let's say, the Congo side, and he enters into the city and finds that many children were not fully vaccinated against the measles, that case of measles will most likely interact with these children who are not vaccinated, and that can lead to a measles outbreak because of the long hard lived that has been because of the poor access and utilization of the measles society. So as a region, really, we still have a lot to do. We need to continue creating awareness about the importance of the routine immunization services, so that we fully protect our children, and we are able to minimize the costs, minimize the dangers that are associated with immunization coverage.
Well, thank you so much. You're watching West Nile TV, and today we are discussing about the routine immunization. And I have Sister Sally from Arua City, who is a senior nursing officer. She's right here with us discussing the routine immunization. And I have a Dr. Gift who comes from all the way from Maracha, and we are all discussing the routine immunization. I wanted to pick up from where he left about saying that in West Nile we still have a lot to do pertaining immunization. Sister Sally, I've been interacting with some of the community members on different platforms, and you realize that one of the issues is that mothers of nowadays, or some parents, prefer taking their children to private clinics, and they feel it is the best or something like that. So I don't know how you can help us pertaining immunization on that line, whether the immunization, whether the routine immunization takes place there, whether the tracking is all set, and to also add on that, whether the services provided, is there any difference in service provision in the private and the government facilities?
Yes.
Yeah.
Thank you so much, moderator. I like what you have put. Dear listeners, this routine immunization program, we run it both in public and private facilities. And one key message I would like to pass to the public is that all immunization programs are free. Free in the sense that whether you come to the private health facility, the services literally are very free, and no health worker is allowed to charge any vaccine. And these facilities are accredited, especially the private health facilities. All our public health facilities are having immunization, and they are following all the procedures expected out of them in storage and how to administer it. So the same way the program runs in the public health facility is the same way in our accredited private health facilities. Not all private health facilities qualify to administer these vaccines, but for a private facility where the district is able to see its capacity, because all private facilities are also supervised by the district health office, and that gives them a picture of whether the private facility, that particular one, has the capacity to maintain or to store and have these vaccines at their center. So if you have not made the measures to carry out this vaccination at your private facility, usually the district doesn't recommend. So therefore, all those private health facilities that have gone through the process of assessment and where we have accredited them to carry out immunization, they pick the vaccines from the districts. And these are monitored by the district cold chain officer who supervises the fridges, how the temperatures are, and how they should request. And this is based on the catchment area these facilities have. So we also do not expect them to, when in inquisition they are guided not to just order so many vaccines which get also listed in their facility. So we have, in every district there's a cold chain technician person who monitors that specific process, and therefore including Arua City, and this happens in the whole country, including Arua City and Maracha, all these districts in West Nile. So therefore, if the private facility does not comply or does not interferes generally with the measures, then of course that facility will be stopped from vaccinating.
Okay. So not all private hospitals qualify to vaccinate?
No.
Okay, I think that is straight and it has been taken home. Dr. Gift, you brought for us the aspect of malaria immunization being a new bone in the routine immunization. So it means that we have been vaccinating other diseases, but now we have got malaria vaccine, which is a new thing. I presume in Uganda, I think this is the first phase of the malaria immunization that is taking place, that has been added onto the other vaccines that we have been giving to our children. Why malaria? Because I know there are many other diseases that has been going on. We had COVID and all that, but malaria has been given a special attention. Why do you think that most of the focus has gone on to malaria?
Okay. Thank you, moderator. It is true, malaria vaccine has been introduced into the routine immunization schedule. And this started the last month, the month of April. Was integrated child days. And the Minister of Health used it as an opportunity to introduce the malaria vaccine into the routine schedule. So we now have a malaria vaccine that is available in all the health facilities in the country that they are offering routine immunization. So the target is, for now, children. We are targeting children, and the child who has not made his or her first birthday is eligible to start. So the total of 4 doses that the child is supposed to receive, and that ideally starts from the routine schedule, it starts at 6 months. So at 6 months, the child is supposed to receive a dose, the second, the 7th, the 8th, then waits for the 18th month and receive the 4th dose. So coming to the question why, malaria for now has been the #1 killer of children under 5 years, especially in the tropical regions. Tropical regions are the regions where the malaria parasite is able to survive. There are those temperate regions which are very cold. The malaria parasite is unable to thrive there. So malaria parasite being a parasite that likes the warm climate, the moist climate, like ours here, is able to thrive very well. So in this kind of climates, malaria has proven to be the #1 killer of the under 5 children. So that's why we have given the priority this time for those kind of children to get vaccinated. So the malaria vaccine is unable to completely prevent malaria in the population. However, it is able to prevent the severe forms of malaria, because what kills a person is the severe malaria. The the uncomplicated, what we call the uncomplicated malaria, does not in most cases kill people. Because malaria starts with the uncomplicated form. If it is not treated in time, now it goes into complications, which is now the severe form. So once a child has gone into severe malaria, the child runs a risk of losing his or her life if it is not timely and appropriately managed. So we are introducing this vaccine so that our children, even if they get malaria, they have minimal risk of going into the severe form, which is able to kill them.
So it means even after the vaccination, the child can still get the malaria?
Even after the vaccination, the child can still be able to get malaria, but will now have reduced the risk of going into severe form of it.
Okay. After getting, the child can still have the treatment, go for more treatments like that.
Yes. Once the child gets infected, the child has to be treated.
Okay.
Malaria.
Yeah, because there is a perception maybe if I've injected my child, oh, he has been vaccinated, so he's already protected and no more malaria. So now if a mother will go to the hospital or health facility and they say, your child has malaria, I will say, no, I tested my child. No. He was vaccinated. So they will start to say that, maybe Sister Sally, you people gave us a wrong thing. It was not the vaccine for malaria. Yes.
That point you have brought is very, very important. So that now means that whereas the children are being vaccinated, people should not forget about the other malaria preventive mechanisms, like sleeping under insecticide-treated bed nets, those environmental controls for malaria prevention, like keeping compounds clean, destroying those waterlogged areas or containers around the homesteads where water can get filled and mosquito comes and eats it there. And so the other measures still remain in place alongside the introduction of the malaria vaccine.
Okay, thank you so much. Let's talk about this malaria vaccine for some time. One, why I want us to talk about it. It is a new thing that has come, and people are yet getting used to it. And I know my people here, particularly in West Nile, when something comes new like this, there is some resistance. Even I know others have started saying, this is something to kill us, or this is something to make us impotent, or this is something. There are a lot of myths that are going on, and possibly, Sister Sally, what can you say about the attitude of the people towards these vaccines, towards this medication, and attending the routine immunizations?
Yeah, thank you so much, moderator. Particularly about the malaria vaccine. The country officially introduced malaria vaccine just in April, 2nd of April was when this was officially launched in the country. So as I speak, these vaccines are in all the districts that were eligible for this vaccination. Why am I saying so? That in the country we are having 107 districts that are participating in malaria vaccination. And this only leaves out districts that have less risk of malaria. Districts like Kadale, those are districts that do not have malaria cases like these other regions. So therefore, West Nile is one of those districts out of the selected the districts in the country. So we are having 13 districts in West Nile. So with all this, we have the vaccine being introduced. So as I speak, our facilities have the malaria vaccine, and we are not running it as a campaign mode. As Dr. Gift has already said, it is a routine which is already incorporated in our previous vaccines. We previously said we had 13 diseases that we are vaccinating against. So now malaria adds the 14th. So we are now having 14 immunizable diseases. So the community from 2nd of April, I've seen there is positive attitude of the community. And then also our leaders have been oriented, and information has been widely in various sources, including radios, including the TVs like this, even the IEC materials that Ministry of Health developed that has gone to grassroots, creating awareness about the new vaccine being incorporated in the immunization sector. So therefore, of course, there will be some other few in the public who still have that negativity, maybe preaching negatively about this vaccine. Therefore, I want to tell the public that malaria vaccine is a very safe vaccine, that the country, Uganda, is not the only one that has implemented this. It's very safe, and as I speak, we are the 6th district in the whole Africa that is now implementing this. So the previous, the five countries that started this have registered progressively good results, showing that they have completely reduced severity of malaria in those countries, and which of course as a country we are moving towards that from April to end of this year, and as we continue this target age group, we shall completely reduce the burden and severity of malaria in our population.
Okay, thank you so much. Ladies and gentlemen, let us catch a break. We shall be right back to continue with the discussions.
West Nile TV, lighting up the region.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
Idozomi joedzelea kanikumizirania yi atizaro tika angutsi yi yani itozwa azwaleni hadi maliasi azo malaria niri ebi otekwa ini kanikupa waraini sandife pe orimabedi meko aro azo malaria atizu waniomve Mr. Vaxa itabo idozu dio azo malaria niri ebi amani trigaza fe kaniku sandife amani dika anzinyiri amavudi ipie rife baruetinia o kokoko rivini tandife bednindi tesadisi government ya madi Uganda niri usugiriko di azodi ya trizuri bo aro malaria atrizudi basadisi riso parialua aro azidi pie aro malaria atrizudi beriso girikondundu susi imbazia imbaziri imbaro vini mbamudini aro mbe malaria vore remi azako azo malaria niri atrizu girikondundu se dika midrimave aro azi ndundo di ayutasiku askuni erianzi nyiri bavure mazako azo ndundo di kiatrizo aro azi ndundo di gia azako mafeindi mitodimu arozo miagaya inyari ara mitodimu aro malaria atrizo Mr. Vaxa isura eri nani adzekoko eri aro azi ala etozo mirua tambazo deleni iyo nizudini angeri mitodi okalamvo alata niriomve yakani lukuta toko aro toko toko alo toko 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 azia madria udukode GP midire eri okalamvo alata niri.
West Nile TV, lighting up the region.
Thank you so much, and we'll be back from that commercial break that we had, and we are proceeding with our discussions this morning. We are talking about the routine immunization, and as we summarize on the malaria vaccine, I would love to bring on board, that is the Dr. Gift. You know, one thing that you mentioned is that people should not forget about the other measures that we have been taking, like sleeping under treated mosquito nets and clearing the bushes around, and making sure that you close your windows early. They look as simple as that, but sometimes they are very important, because the more you leave your windows open late in the night, you find that the mosquitoes enter and they bite your children and use you yourself, and you get infected. There was another campaign, I don't know whether it was not, I don't know whether it's a campaign or something, but there were artificial mosquitoes introduced. I don't know whether you are aware about that, but all in a way to reduce the breeding of the female anopheles mosquito and all that. So these are all ways that we are using to reduce the spread of malaria. Talking about the vaccine that has come, how do you really grade this vaccine, or what is the response of the community towards the malaria vaccine? Like we said, it's a new thing. It has just lasted like for 1 month, I would say. How is the response, and how are people getting it, as you summarize the malaria vaccination?
Thank you, moderator. Indeed, the malaria vaccine is a new vaccine that has come in. However, the community has to embrace it, because the intention of the government of introducing vaccination in general is a positive one, is a protective one. The government is trying to think about the safety of these people, of our people. That's why it is introducing this kind of program, so the community should be able to address. So being a new thing, that's why we are here. We are here to inform our communities that what has come is new, and it is safe and effective vaccine. Just like the sister had already said, we are not the first country to start using this vaccine. There are other countries within Africa that have already been using this vaccine. Countries like Ghana and some other countries, they have already been using this. and the results have been impressive, that it has been able to reduce the burden of under 5 children dying in the hands of malaria. So why not our children as Uganda? Why can't we also protect our children as a country? So the issue is information. We have health workers around. We have community health workers around who are working with our community day in, day out, trying to pass these messages. So our communities should be able to listen to these messages. They should be able to come to the health facilities and get these services for free. Because the vaccines are readily available in the health facilities, they should come and get them for free, so that we are able to reduce the bad effects that malaria has been causing in our families. You are aware that a sick child in a home means sick parents. The child is sick. Maybe the mother has to go the child to the hospital. This mother will be admitted there. Once the mother is admitted with the baby there, the other children at home, the father has to remain around and take care of them. That means this father cannot go and they look for other ways of making ends meet, making food on table in this home. So it has an impact on the economy of the family. It has an impact on the education of this child. A sick child cannot go and sit in a class. So we want to reduce on these burdens that are associated with malaria in general. And we think that with the introduction of the malaria vaccine alongside the previously existing malaria preventive mechanisms, we can be able to totally reduce the number of children falling sick, requiring admission, and the number of children who are dying in the hands of malaria in our communities. Thank you very much.
Yeah, thank you so much for really highlighting a lot about the malaria vaccine. Ladies and gentlemen, we want to thank you for watching West Nile TV this particular time, and we are discussing about the malaria vaccine. If you joined us lately, you can still watch this on YouTube. Yeah, you go onto our social media handles, YouTube, type West Nile TV. You'll still get the same talk show running on there. You can follow us on Facebook. You can follow us on X. You can follow us on different media platforms for you to be updated. And right now, as we are going to summarize most of our discussions at this time, I would love to invite Sister Sally to give for us the benefits of this malaria vaccine. Maybe what are the benefits that it comes with as you summarize now the whole routine immunization and all that?
Yes. Yeah, thank you so much, moderator. My dear listeners, immunization has very many benefits that you can actually mention some of them, and you can feel some of them in your own home. One of it is that immunization reduces risk of disease. Children who are fully immunized, they do not stand that chance of getting sick easily. So it reduces that disease burden in the community. 2, that many of these preventable diseases, if a child is immunized, does not have a serious illness. Just like Doctor has been speaking about malaria vaccine, which is one of them, that if a child is vaccinated, even if it is measles, whatever disease we are vaccinating against, this child will not get the severe form of this disease. So it won't be so serious that it can kill this child. Another benefit of this immunization is that it reduces the burden on healthcare system. How? The healthcare system spends a lot of money in these immunizable diseases, in terms of procuring the medicines, in terms of human resource. So cost of running or this country in terms of sickness is so expensive. So it is very good that it reduces burden on the healthcare system of spending a lot of money on treating disease. It also prevents disease outbreak. If we are able to immunize our children, we are going to reduce these common outbreaks that will occur in our country and in our district as well. So it helps in developing herd immunity. The doctor explained about herd immunity, that if majority of our targeted population is vaccinated, in case of few that missed the vaccination, then they will be protected in a way that if majority of the population is vaccinated, then disease outbreaks may not be there. So this person who has never been vaccinated will stand a chance maybe of getting well because of others who are really vaccinated themselves. So herd immunity is one key benefit that we realize. And then another good benefit is that it reduces the burden on the society. How does immunization reduce burden on society? We say if these children are not vaccinated, they get disease, they are hospitalized, they die. Mortality rates are very high. So when death occurs, take a community like ours in West Nile. Do you know how much people spend in funerals? A lot of money that the society loses. When someone dies, they spend a lot. So it means if we prevent this mortality due to preventable diseases, then we are going to reduce that burden for what? For the society. Spend a lot of money in treating this child, in the burials. So that is a very good benefit for the community as well. And then it increases productivity. It increases productivity because when you have a sick child every time, as Dr. said, parent is also affected too. Because every time you are hospitalized, you can't go to the garden, your business is at standstill, even your routine work, you can't do it because you have a sick child in the home. So it's a very important thing that we need a productive community that should be able to work, that should be able to bring food on their table. That should not be a community that is always taking care of sick children in the world, in the health facilities. So it strengthens the immune system as well. When we vaccinate all our children or all the eligible age groups that need to be vaccinated, then we are going to strengthen the immune system in these persons that they won't contract disease easily. So that is a plus for us as well. Then it contributes to the overall health well-being. The whole country will be having a very healthy population, and that is a major goal that the country is looking at, to have a very healthy community and a country that is productive. So it prevents also, as we said, the mortality rates. Most of our children die under 5s. They die of immunizable preventable diseases. And as we speak, I think the uptake of this immunization significantly shows us that there is a lot of benefit that even at facility level we are able to feel. If you look at those years, our pediatric ward will be full of children under 5. And in if you see the burden now, we do not have so many sick children as before. And we used to have wards in the hospitals labeled diarrhea ward. And actually when you reach a health facility, you really feel that you are closer to a diarrhea ward. But this is not now in our facilities. Don't see those labels as well, because we have again introduced the vaccine against what? Against diarrhea. So we do not have, that is giving us a very good picture that this vaccine is benefiting our nation. Lastly, these vaccines are very safe and they are very effective, but I urge our community to take our message positively, and those who have never got the opportunity for certain information, be that teacher, be that person who should be able to pass an information to a neighbor, to a friend, and the whole family would benefit from your message.
Okay, yeah, thank you so much, Sister Sally, for giving us the benefits of the vaccines, the routine vaccines that we are taking, that is the malaria vaccine inclusive. What if, like we said, there are people who are still on 0 dose. What if there is a parent right now? What can you tell this parent who has never vaccinated their child and all that, or someone is just negative? I understand there's some sect of religion who doesn't want their children to be immunized and all that. So maybe someone is watching us right now and has never taken their children for immunization. What do you have to tell them?
Yeah, thank you so much, Margarita, and to my dear listeners. If we have children who have never benefited from any vaccination, the 0 dose children we are bringing here, please realize it now and bring this child to the nearest health facility. And it will be our pride to have this child vaccinated. At whatever age that child is, do not hesitate to remain at home. We can still start this child from your arrival with this child. This child will benefit from all other vaccines from the day you bring this child to the facility. And to my dear health workers, that if we are able to get these 0 dose children, we need a lot of information to them. We do not need to scare them away. They might be having reasons why they have made this child to miss at that level. If we have a scary image towards these children or towards these families, they will never come out. So let's show our positivity as the health workers, do the rightful things and start this child from your first visit with this child, whether in the community when you are for the outreach. If you happen to land on one, please give a lot of information to this parent. Let this parent be this person who will not default from the time you get this child. And you need also a lot of tracking for this kind of children. 0 dose, because you may start and again they lapse on the way. So they need a lot of information. Thank you.
Thank you so much, Dr. Gift. Now, let's highlight the procedures of the malaria vaccine, because I feel it's one of the key points that we need to emphasize right now, particularly who is eligible to receive this vaccine, because an adult might surface there and say that I want this vaccine. So who is eligible for the malaria vaccine, and for how long does the person take the malaria vaccine? So I think that is one of the most important points that we need to re-emphasize right now. And maybe Sister talked about some of the places where we can get the government facilities and all that. particularly in Arua here, if there are spots that you know that we can get the malaria vaccine, you can also give us in brief because we have a few minutes for us to close this.
Okay, thank you, Director. The malaria vaccine is given through an injection, and the injection has to be given on the anterior right side of the child.
It's right up.
Right up. So the child is going to receive 4 of those injections. And for now, any child who is less than 1 year is eligible to start. Less than 1 year, but more than 6 months. So from 6 months, we expect the child to start the malaria vaccine. So at 6 months, the child is going to receive an injection, goes and stays for 1 month, comes back for the second injection, goes and stays for another month, comes for the third injection. Then the child will wait when he or she reaches 1 year and 6 months, 1.5 years, comes and now completes the malaria vaccine.
Okay.
So the malaria vaccine is readily available in all the accredited immunization service care points in all the districts that system also. So both public and private health facilities that are UNEPI accredited provide routine immunization services. That means they have a fridge in place that is supposed to maintain the cold chain, because our vaccines, the malaria vaccine, survives within a temperature of 2 degrees Celsius to 8 degrees Celsius. So that means any temperature below that, or any temperature more than 8, below 2, more than 8 is going to destroy our vaccines. So it will make the vaccines impotent. So once the vaccines are impotent, they will not be able to provide the child the need that we want. So that facility should be having that kind of establishment of the cold chain.
What are these small refrigerators that people move here to the nurses?
Those are vaccine carriers.
They are good also, we can still use them.
Yes.
Those are vaccine carriers. They use them now to pick the vaccines in small quantities from the fridge to the immunization care point. Yes. So in all the accredited immunization, routine immunization care facilities within the region, we have the vaccine available, and our communities will come and
Okay, yes.
Just to add on to what Dr. said, to my health workers, let's schedule our children very, very well. As from first dose to the last dose, the 4 doses, the schedule, the health workers should know it very well, and also inform the parents or the caretakers very well on when to return the child for the next dose. And as Doctor said, all these children who lie between 6 months to a year, that is 12 months, they are eligible for first dose. And of course, he has said from dose 1 to dose 3, the interval is 4 weeks, that is 1 month. So if this child has got the 3rd dose, you schedule and give this child a return date of 6 months. So for a child who has started from 7 months, 8 months, 9 months, so their month of coming back may vary in a way that the 6 months, when you add on to when this child gets the last dose, should be able to give this child a 4th vaccination, which is the last one. So the schedule 1 month up to 3 doses, and then the interval between the 3rd dose to the last dose is 6 months. Yeah, thank you so much.
Okay, what if someone, immunization has taken place today, and you know their dose is a routine immunization that happens. Yeah, we know malaria has been inclusive, but someone comes even maybe their day for the birthday of the child is maybe next week or some other time, and finds a different
and you are giving this child interval 4 weeks, and this 4 weeks has not reached, when this child reaches your facility, even if the child is left with maybe 3 or 4 days to complete the 4 weeks, please don't give.
Okay.
The child first has to complete the 4 weeks before you administer the second dose. And
Okay.
then, in case this child maybe comes beyond the dates, do not send them away. You have to vaccinate this child. So let's follow the schedule.
So does it mean that the malaria vaccine has been included now on that card? The immunization card, is it there?
The current immunization schedule now has the malaria vaccine.
Yes.
Even the tally sheets has all been modified.
Okay.
Yes, it
Yeah.
includes the malaria vaccine.
Because that is very important. Many mothers consider carrying that card, and it helps the health workers. Dr. Gift, your last words. Time is up.
Thank you, the viewers. I encourage all our mothers to deliver in the health facilities. If our mothers deliver in the health facilities, the child will enter the routine schedule there and there, because there are vaccines that they are given at the back. That will be the best time for entry. So by doing that, we reduce the 0 doses automatically. So I encourage all our mothers to deliver in the health facilities, to start antenatal early. All that care is free of charge, and they should embrace it. Vaccines are safe, readily available. They should bring their children to get immunized, so that we are able to reduce the burden of the vaccine preventable diseases, so that we raise healthy children. Healthy children is the healthy nation.
Thank you. Yeah, the last words.
Yeah, thank you so much, my dear listeners. I'm so happy for having this time with you. My last message is to all the stakeholders in every various communities or administrative places, that this message should go to your catchment area, be this person to inform others. And secondly, no public places or no community should sabotage against this. In case of any sabotage on the government well-motive schedule like this, please, the stakeholders of that place should take it up and report appropriately, because this is to benefit all our population, and there's no government that will really wish to introduce something which is not safe. So therefore, this vaccine is safe and no sabotage against it. You have heard about the benefits. Be able to bring your children for vaccination at your nearest health facility. Thank you.
Thank you so much for watching. Like I said, you watch this on YouTube, and you can also follow us on different social media platforms, on Facebook, on X. We can update you on any other information that you really want. But here it has been me, Fete Manuel, your host, and I've been together with Sister Sally Andezu, who is a senior nursing officer in Arua City. And we also have, that is Dr. Gift, Dr. Gift Asugo Patrick, who is also one of our guests today. And remember, this talk show is proudly sponsored by the Ministry of Health, and that is UCRIP. Yeah, Ministry of Health and UCRIP. Thank you so much for caring for the people of West Nile, and for making sure that our children are safe from malaria. Have a blessed weekend, and we are out of here. See you next time.
West Nile TV, lighting up the region.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800-100-066. This message is brought to you by the Ministry of Health.
Idozo mijoejelea kanikumizirania yi atizaro tika angutsi yi yani itozwa azwaleni hadu maliasi azo malaria niri ebi ote kwa ini kanikupa waraini sandife pe orimabedi meko aro azo malaria atizu panomve Mr. Vaxa itabo idozo dio azo malaria niri ebi amani drigaza fe kaniku sandife amani dika anzinyiri amavudi ipie rife baruetinya o kokoko revini tandife bedninde tesadisi government ya madi Uganda niri usugeriko di azodi ya trizuri bo aro malaria atizudi basadisi riso parialua aro azidi pie aro malaria atizudi beriso gerikondundu susi imbazia imbaziri imbaro vini imbamu diniaro aro mbe malaria vore remi azako azo malaria niri atizu gerikondundu se dika midrimave aro azi ndundo di ayutasiku askuni erianzi nyiri bavur mazako azo ndundo di kia trizo aro azi ndundo di gia zako mafeindi mitodimu aro zo miagaya inyari ara mitodimu aro malaria trizo Mr. Vaxa isura